Welcome to EmpowerAfriq First Aid, Chapters 5 and 6. In the wild, or even in our own homes, a crisis can strike in a heartbeat. Knowing what to do in those first few minutes is everything. It is the difference between panic and purpose, between a bad situation getting worse and a life being saved. This guide is not about making you a doctor. It is about giving you simple, clear, practical skills. Everyone can learn first aid. Everyone can be the person who steps up when it matters most. You are the first responder until help arrives. Your actions are what count in that critical window. Early action saves lives. This unit focuses on two of the most serious conditions you might face: shock and unconsciousness. Shock is a life-threatening condition where the body's circulation fails, meaning vital organs do not get enough blood and oxygen. Unconsciousness is when a person is completely unresponsive and cannot be woken up. They are in immediate danger, often because their airway can become blocked. Keep these simple definitions in your mind. We will break down the steps for each condition. Shock is a silent killer that can follow almost any serious injury or illness. It is not about being emotionally shocked. It is a critical physical failure. Imagine the body as a network of pipes delivering blood and oxygen. When shock sets in, that delivery system starts to shut down. Common causes include severe bleeding, burns, serious injuries, severe allergic reactions, heart problems, severe infections, dehydration, and poisoning. Look for pale, cold, clammy skin, a rapid or weak pulse, fast, shallow breathing, weakness, dizziness, nausea or vomiting, confusion, thirst, and in severe cases, loss of consciousness. If you suspect shock, ensure the scene is safe, then call for emergency medical help immediately. Lay the person flat on their back. If there is no head, neck, or spinal injury, raise the legs about 30 centimeters. Keep them warm with a blanket or jacket, and apply direct pressure to any visible bleeding. Do not give food or drink. Monitor breathing, pulse, and responsiveness until help arrives. Your calm, simple actions are their best chance. Shock is always a medical emergency. Call for help early, position correctly, keep warm, and monitor continuously. Next, unconsciousness and the recovery position. Ensure scene safety. Call for help. Lay flat. Elevate legs if safe. Keep warm. Control bleeding. Do not give food or drink. Monitor until professionals arrive. Unconsciousness is a state of total unresponsiveness. The person looks asleep. You cannot wake them. They will not respond when you call their name or tap their shoulders. A major red flag. Causes can include head injury, stroke, heart attack, low blood sugar, poisoning, alcohol or drug use, lack of oxygen, severe illness, or shock. The greatest danger is the airway. Relaxed muscles let the tongue fall back, like a plug in a drain, blocking airflow. Fluids like saliva, blood, or vomit can be inhaled into the lungs, causing choking, lung damage, or death. First, check for responsiveness. Shout for help. Call emergency services immediately, and put your phone on speaker if you are alone. Open the airway. Place one hand on the forehead, gently tilt back, and lift the chin with 2 fingertips. Look for chest rise, listen for breaths, and feel for airflow on your cheek, for no more than 10 seconds. If breathing normally, use the recovery position. If not, or only gasping, begin CPR immediately. Early action saves lives. It is all about airway and breathing. The recovery position keeps the airway open and lets fluids drain safely while the person breathes on their own. Use it when the casualty is unconscious but breathing normally and there is no suspected spinal injury. Do not use it if breathing is absent or abnormal. Start CPR. If you suspect spinal injury, only turn them if absolutely necessary to clear the airway, such as active vomiting. Kneel beside the person. Place the arm nearest you at a right angle, elbow bent, palm up. Bring the far arm across the chest. Hold the back of that hand against the cheek nearest you. Grasp the far leg above the knee and pull up until the foot rests flat on the floor. Gently pull the bent knee to roll them towards you onto their side. Adjust the top leg, hip and knee at right angles to prop and prevent rolling forward. Slightly tilt the head back, angle the mouth downward for drainage. Keep them warm and never leave them alone. Monitor breathing until help arrives. While shock and unconsciousness are critical, many other emergencies require quick thinking. Stay calm, ensure scene safety, assess quickly, call for emergency help early, provide appropriate first aid, and monitor continuously. For a suspected heart attack, chest pain or pressure and shortness of breath, call for help immediately and have them sit and rest. For a stroke, remember: fast, face drooping, arm weakness, speech difficulty, time to call emergency services. Recognizing these signs fast is the most important action you can take. For an asthma attack, help them sit upright, keep calm, and assist with their prescribed reliever inhaler. If no improvement, call for help. For suspected low blood sugar and the person is conscious and can swallow, give a sugary drink or glucose tablets. If they are unconscious, do not put anything in their mouth. Place them in the recovery position and call for help. During a seizure, remove nearby hazards and cushion the head. Do not restrain movements. After the shaking stops, check breathing and place in the recovery position. If they cannot breathe, cough or speak, give up to 5 back blows, then up to 5 abdominal thrusts. Alternate until the object comes out or help arrives. For anaphylaxis, call immediately and help them use their adrenaline auto-injector. Lay them down and keep them warm. For poisoning, call emergency services or poison control right away. Give details of the substance and do not induce vomiting unless instructed. During all emergencies, observe breathing and pulse, monitor consciousness, record changes, and be ready to start CPR. Never underestimate these fundamentals. In crisis, they are everything. Never give food or drink to someone who is not fully conscious. Your role is not to diagnose or cure, but to protect and preserve life until experts take over. Read through these steps, talk with your family, find a CPR course, and practice the recovery position. Confidence is built through repetition. Turn this knowledge into a reflex. Stay calm, make the scene safe, call for help, and follow the simple steps you've learned. Subscribe to EmpowerAfriq Skill Academy for more life-saving lessons.